have a couple of updates for you as a team. And then I think that unless there is some kind of broad overarching consensus or uproar, this is going to be our last bi-weekly meeting, and we're going to transition into meetings with your respective program staff. So the Learn and Earn group will continue to meet, the Earn providers will continue to meet, the youth providers will continue to kind of and of course, Sean, I see you up in my top left corner, the operator and career link partners will continue to meet as well. But we think that with us moving into green tomorrow, then there aren't sufficient changes that are happening regularly to justify making sure that everyone meets on a bi-weekly basis. If anyone is opposed to that, please do let us know and feel free to jump in, but we thought we'd give you back a couple hours in your month to be able to finally find the end of your inbox. Has anyone managed to do that in the past 9 weeks? I don't think 12, how many weeks? Year and a half since March? Yeah. All right. Wonderful. So I am going to turn things over to Dylan Moore on our team to give you a little bit of a policy update. There have been some changes that have happened and to talk a little bit about what the green phase means. It does not mean go, as Andy and my 4-year-olds have reminded us, green means go, but not in this case. So Dylan can give you a little bit more on what green means and what we're hearing from the state as far as coordination and what it means for your programs. And then after that, those of you that have reopened or that are planning on reopening tomorrow, we would love to hear if you've got some feedback to share on what your challenges have been, ways that we can be helpful, and ways that other folks on the call can learn from you, because there's no sense in us all figuring this out independently from one another. So I'll turn it over to Dylan.
All right, thanks, Susie. I'm going to try to share my screen here. All right, so hopefully you guys can see this. So I just wanted to provide updates on 2 key areas for this week, and thanks again for everyone for continuing to join us on these weekly to bi-weekly calls. So the first thing that I wanted to update everyone on is that, I'm sure a lot of you probably have read about this, but last Friday, Governor Wolf did sign into law a interim legislation that provides for a short-term budget. So it's a $25.7 billion budget, and basically it is set to provide flat funding for the majority of state agencies for the next 5 months. So the amount of budget that was designated for the agencies last year, that funding is being continued for the next 5 months through the end of November 2020. The one area where there's a little bit of difference is with the Department of Education. The budget that was signed into law provides for flat funding for the Department of Education for the next 12 months, so for a full year. And that's really set to ensure that education and public education that has experienced typically budget increases for the past several years does not experience any type of budget cut over the next year. One key item of importance also in the budget is that the legislation signed does designate $2.6 billion of, I believe, was $3.9 billion in total that Pennsylvania received from the CARES Act legislation at the federal level. So it designates areas where that portion of money will go during this next year. So if you look at the slide here, there's a bit of a breakdown of some of the key items from the CARES Act funding. So it includes a $625 billion block grant funding for counties, and that's really meant to offset some of the lost revenue expenses that counties and local governments have experienced during the COVID-19 response to help provide for additional personal protective equipment and health equipment required to continue to address the COVID-19 response. And that money is really meant to help those governments on that facet. Another item is that there's $420 million from the CARES Act funding to help assist nursing homes and other long-term care facilities that have experienced a lot of expenses and have been hit pretty hard due to the COVID-19 crisis. So that's really meant to help supplement some of that lost revenue and expenses for those facilities. There's also $300 million that is really worked to replenish some of the loss in gaming revenue that the state uses to provide property tax relief to homeowners. So as we look to potential risks of people defaulting on mortgages or evictions and those types of things, that money is really meant to help provide some housing assistance and relief to homeowners during this crisis and the recovery. There's also $225 million through the Department of Community and Economic Development, which we made available in grants for small businesses. I don't know the details exactly on what those grants will look like, but it's additional funding to help support businesses in Pennsylvania that have taken a hit during the crisis. And the last point, there is some additional funding for early child care services, some additional support for food assistance for any households that are experiencing any type of food insecurity, and then some additional, as I mentioned before, some assistance around housing to prevent any type of foreclosure or evictions. So I think there will be some more details on exactly what this looks like in implementation, but just wanted to give you guys a quick update on some of the key points that came out of this interim budget. And then, as we look towards the 5-month mark, I think that's where we'll look towards, what potential cuts or reductions in the budget in different areas might look like as the legislator and the governor's office thinks through what the budget's going to look like after that 5-month mark. But the next item, as Susie mentioned, I just wanted to update everyone on what it actually means as we move to this green phase. So I'm sure most of you have heard that the governor has announced that Allegheny County will move to the green phase starting tomorrow, June 5th. And the bullet points below show some of the key requirements that were written out in an order that the governor issued alongside this announcement. So as Susie had mentioned, it does not mean business as usual or business back to normal. Some of the key points. So businesses that were permitted during the yellow phase to operate at 50%, they are permitted to increase 50% capacity. So 50% of the number of people permitted in a facility. They're permitted to increase this to 75%. If a business was not permitted to operate during the yellow phase fully, so those are businesses like restaurants, bars, and movie theaters, and other types of entertainment facilities, they can operate now, but they must operate at a 50% capacity. The maximum limit on large gatherings did increase somewhat, but there's still a limitation that no large gatherings above 250 people are permitted. Personal care services, things like hair salons and barbershops, they can operate at 50% capacity, but there is a requirement that these specific locations and businesses operate by appointment only. And businesses that are gyms and spas, they can operate at 50% capacity, and the governor's order strongly encouraged that these businesses, not a requirement, but strongly encouraged that they also operate by appointment only. Another item is that visitation to prisons and hospitals that were previously restricted under the red and yellow phases can resume, but this is left up to the discretion of the facility. So a hospital or prison may continue the restriction, but it's not a statewide restriction at this time. But in terms of the nursing homes and long-term care facilities, due to the increased risk of these facilities, the restrictions remain in place during the green phase in terms of visitation of these facilities. And with all of this said around flexibility, it's still stressed very strongly that businesses should continue to follow any types of guidance or guidelines from the CDC, as well as the state and local departments of health guidelines. So what that means is that any types of social distancing requirements that are still in place, things around wearing masks and other types of PPE, those are still required for businesses. So that may mean that a business that is allowed to operate at 50% capacity or 75% capacity may not be able to do so if the structuring of their facility to ensure that social distancing is in place, such as the where desks are placed in a office or where dining tables are placed in a restaurant, it may not allow or permit a restaurant to operate at that full 50% or 75% capacity. So it is really stressed that businesses continue to follow these guidelines as we move to the green phase. And that is it for me on the policy update side. Thanks.
Thanks, Dylan. Before I turn it over to questions, then I just want to make a couple of points related to what Dylan just updated us on. One is that we know that childcare is an issue and is going to continue to be an issue. And please do keep us posted on what your clients are experiencing as you reopen and as your clients try to start to go back to work. Partner for Work, along with the Hillman Foundation, has convened a coalition of folks to talk about how we recover on the workforce development side from all of this. And one of the kind of subcommittees of that group is to talk about childcare. And so that's being done in partnership with Allegheny County DHS and the ELRCs. It's being done in partnership with the United Way. It's being done in partnership with a number of businesses who really feel very strongly about this and want to take the lead on it. There are two kind of childcare issues. One is well, there are more than two childcare issues, but we're hearing that availability of childcare is not the concern, and that there are spots available for folks if they are interested in putting their children in care. The concerns are A, making sure that parents feel that their children will be safe in a congregate care setting and making sure that there is sufficient space to be able to spread out. And those sorts of things. And, you know, on a personal level, as a mother of a 4-year-old who it's a daily fight if we go anywhere to get her to wear a mask, I don't know how child care centers will get children to wear masks at any point in time. And so that's certainly a concern. The other concern, obviously, is funding and staff. And if child care facilities have to spread out or reduce ratios or whatever the case may be. Oh, and I should say Trying Together is another member of this conversation, because we are not child care experts. We are workforce development experts, but certainly don't know the ins and outs of the child care system in the way that Trying Together and the ELRCs do. And so we're kind of shedding the workforce light on things as they're involving those conversations. So we'll keep you posted, but please do, if there are other things that as your clients get ready to start to go back to work or are interested in, you know, coming back into your spaces and you're having struggles with, or you're seeing as themes, please let your contacted Partner for Work know, because it's the only way that we can help to advocate for changes on the policy level and answer to some of these questions that you have, is if you're willing to share with us what are the challenges that your staff and your clients are going through. Two other things. One is that our funding can be utilized to purchase PPE for your staff, for your clients, if you need to, cleaning supplies, those sorts of things. We would expect that you would follow a very similar cost allocation plan if you have multiple programs in the building. So if you have a program that's funded by Partner for Work in the same building as a program that's funded by, say, the city or a foundation or something along those lines, that the proportionate amount of cleaning products that would be used in your space for Partner for Work programming would be paid for by our programs. We know PPE is going to be a new expense this year, and so be thinking about that for your budgets. And we do think it's critical. And then related to personally protective equipment and related to reopening, our expectation is that you'll continue virtual services where and when possible, and that when you do reopen your doors, that those services will be available by appointment only to start. And so if you want to do something different than that, please do let us know and talk it through with us. You can, and you have our support. If you have said to a client or a participant who's coming in, our expectation is that you will wear a mask while you're on site. And if you don't have one, one will be provided to you. Then it's okay with us if that person refuses to wear a mask for you to say, okay, you cannot get services in this facility. But what we ask is that the message is, you cannot get services in this facility, but services are available to you virtually online here and by calling this number. So we're not turning anyone away from services. We are saying to them that services are not available in person unless you're willing to wear a mask. Now, if your organization has determined that masks are not required for one reason or another, you have sufficient space, you're outdoors, whatever the case may be, we're not also going to come down and say to you that everyone has to wear a mask. That's not where we're falling in line, but we will support you as long as you say, if you don't wear a mask, then services are available to you online or virtually. We're just not turning anyone down completely. And one of the things that we're looking at and that we encourage is if you're finding virtual training opportunities, and we'll share out a list that we're looking at compiling of virtual training opportunities that are meaningful and that are connected to jobs, then those can be part of your service portfolio. Especially on the adult and the out of school youth side, we think it's going to be really important that people take this downtime to make sure that they are trained and ready to go back to work when businesses reopen. So with that, I will stop and ask if there are any questions on anything Dylan or I just said, and or if anyone has reopened their doors and has some lessons learned that they are interested in sharing. I think that we learn best from each other, so I would welcome that feedback. Nothing so far. I'm going to also drop a link in the chat. For those of you familiar with SimCoach games, several years ago, Learn and Earn participants built several games for SimCoach on how to get ready for a job, get dressed for a job interview, get prepared for a job interview. Auberly has since built a game with SimCoach. And we built another game with SimCoach called Buoys, a ghost code, which is about assessing someone. There's also a new Buoys game that does career exploration and is related to, I think the Consortium for Public Education helped build that one. And then there are a litany of games in the construction field for career exploration and for actual job skills. There are EVS training, environmental service technician training opportunities and games there. So they're just a great resource too for online services, and they are available for free. You can download them in the App Store on iPhone or iTunes rather, Apple and Amazon and Google Play, I believe. Any other questions, or anyone from my team want to say anything? Not putting anybody on the spot that doesn't want to talk. All right, with that, you get 38 minutes back in your day. So thank you, everyone. I cannot stress enough how much we value the work that you do, and how excited we are that you get to do some of that in person again. But that our priority is always on keeping folks, including our staff, our provider staff, and our participants safe. So making sure that you're doing that and that you are connecting folks in with jobs as much as we possibly can is incredibly important to us. So thank you all so much. Feel free you have our contact information. Reach out to us if you need anything. Take care.
Thank you. Bye-bye.